imkanı bana verdiği için çok teşekkür ederim öncelikle. So, hello everyone. Today I am going to present my postdoctoral research, and also before that, I want to also introduce myself because it's also an opportunity for me to introduce myself to you. I started working at Eurasia Institute in March 2022. Before that, my background, I would like to introduce also my background and also the other my studies to you. My background is environmental engineering. I graduated from Marmara University, and my PhD was also carried out in environmental engineering in Marmara University, and my thesis was the title of my thesis was Investigation of the Impact of Urbanization on Climate and Air Quality, a case study over Turkey. In my PhD, my supervisors were working in Marmara University and also Istanbul Technical University. So I had a collaboration at that time with my lecturers from Eurasia Institute, and also my first supervisor was from Marmara University Environmental Engineering Department. In my PhD, I studied the urban heat island over Turkey, and also one of the important effect of urbanization is air quality. So I did air quality measurements in Istanbul. I took samples of particulate matter PM10 and PM2.5 and did some instrumental analysis like heavy metal analysis and also black carbon in particulate matter. And after that, I used meteorological model WRF and air quality model CMEC to explore the spatial and temporal distribution of air pollutants over Istanbul, sorry. And at that time, we have produced two journal articles from this study, which were published in Theoretical and Applied Climatology and Science of the Total Environment. Then between 2013 and 2017, I involved in a TÜBİTAK project, which was in the program of 1007. It was a research project actually, but we worked with the Ministry of Environment, Urbanization and Climate Change. The topic was the development of National Air Pollution Inventory Management System. At that time, I was working as a research assistant at Environmental Engineering Department of Bahçeşehir University in Istanbul. After that project, I did my postdoctoral research in Denmark at Aarhus University Environmental Science Department. And the topic at my postdoctoral research was to investigate the impact of this statement is wrong. In my postdoctoral research, I investigated the impact of air pollution on human health and economy of Turkey in Denmark. After finishing my postdoctoral research, I worked in a European Union project in Ankara, which was the improving air quality in cities in Turkey with raising the public awareness. It was a European Union project which was implemented in under IPA 2 program. And just before starting here, this project was finished, and I worked as a team leader in that project. So let's start the presentation with an introduction about the health and air pollution relation. According to the information given from European Environment Agency, 97% of the urban population in Turkey is exposed to unhealthy levels of particulate matter, which is one of the most important air pollutants. And due to that, Turkey emerges as a country with one of the highest rates of premature deaths, which is over 28,000 due to air pollution in Europe from mainly ambient particulate matter and ozone exposure. And the indirect impact of this air pollution on the economy in terms of health can be billions of dollars. So there's not just a health issue here, also there's a very important level of economic effect on the countries. In my study, the effect of air pollution on human health, including both morbidity and mortality, and their cost to the economy, is calculated for the first time, covering all over Turkey. To quantify this, we use the EVA model, which is estimating the economic valuation of air pollution. And this model is coupled with an air quality model, which is a Danish earlier in hemispheric model, shortly DAM. DAM is an offline atmospheric chemistry and transport model, which is a 3D model developed to investigate the long-range transport of air pollutants in Europe and the Northern Hemisphere. DAM uses the EMIP air pollution inventory and also uses the outputs of the WRF mesoscale weather prediction model outputs. EVA is based on the impact pathway chain to assess the health-related economic impact of air pollution resulting from several emission sources. This helps to support, the result of this model helps to support policymaking with respect to emission control. It uses pollutant concentrations which are estimated from the DAM model and also uses the population density and exposure response functions to evaluate the impact of air pollution on health and economy. Main emission sources used in these models are defined by the 10 SNAP categories in Turkey in this study to estimate the economic loss linked to health problems with using these meteorology, air quality, and EVA modeling system. As we all know, increasing population, also traffic and industry, all increases the air pollution levels all around the world. And in Turkey, we have also the same issue with these reasons. And concentration, air pollutant concentrations are especially exceeding limits, health limits in winter months, and these are producing health problems and economic loss. This graphic is from one of my research study, which is showing the particulate matter concentrations annually in Istanbul. And we here see that the concentration levels are exceeding the European World Health Organization particulate matter concentration limits, and especially, as I said, in the winter season. In the air quality model, we use the SNAP categories, which are defined in European Union EMAP guidelines. This EMAP guideline is used as a beginning step, actually, to start the air quality modeling study. These SNAP categories shows all the air pollution sources, like the industrial sector, residential heating, and also the other air pollution sources like traffic, road transport, the other mobile sources like the aviation, shipping emissions, and including agriculture and so on. So we take these emission categories from the emission data used in European Union research studies. For the modeling study, I used 3 domains. The first domain covers the northern hemisphere with a resolution of 150 kilometers. Then the second domain covers Europe, which has 50 kilometer resolution. And lastly, the domain for Turkey has a resolution of 16 kilometers. After running WRF and air quality model DAM, we estimated the output air pollution concentrations. These concentrations are used as an input in EVA model. And as I said, all the source of air pollutions are used to estimate the air pollution concentrations, which are going to be used in EVA model. The graph here shows the pathway of this study. First, the air pollution concentrations are estimated with the regional dispersion model, which is here DAM. It produced the concentrations, air pollution concentrations, temporal and spatially. And then we used the population data of the cities in Turkey to calculate the exposure. With the exposure response functions in the literature, the effect on human health is estimated. And finally, with the calculated impacts on health, the EVA model estimates the resulting cost for Turkey. The upper left graph shows the methodology where the DAM air quality model uses. It includes the atmospheric chemistry reactions to estimate the concentrations of air pollutants. On the right upper side, we see the monitoring stations, air quality monitoring stations that we used in this study. These are used to evaluate the results of air quality model. We compared the model results with the monitoring stations. Then, as I just said in the previous slide, we used the population data in the EVA model, which is shown in the below graph. Then the model estimates the pollutant concentrations, and here we see the concentration distribution for NO2, ozone, and PM2.5 for the base case study in 2017. Then, to evaluate the results of the air quality model, we used the monitoring station data to compare the observations and model results. These scatter plots are showing the comparison of these model and monitoring station measurements. And these are the metrics to analyze the comparison results of the pollutants, pollutant data coming from the air quality model dam and air quality measurement stations. We have correlation more or less 0.5 for PM10 and PM2.5. Of course, this study can be improved in time to increase these correlation factors. There are several factors affecting the uncertainty in these modeling results for the air quality models. The emission inventory is one of the reasons to have these correlation factors less or more than 0.5 here. And these graphs are showing the outputs of the EVA model. And here we see the acute mortality and chronic mortality, and the last graph on the right shows the total mortality over Turkey for the base case simulation in 2017. Here we see that most of the mortality cases are concentrated in the mega cities like Istanbul, Ankara, and Izmir, where the pollution sources are contributing the air quality a lot, like industry, traffic, and residential heating. And lastly, the EVA model estimated the number of mortality cases for the base case simulation, which is over 60,000 for Turkey, which means in 2017, from air pollution impact, we had over 60,000 lost in Turkey. And the model estimates the total cost of this air pollution health impact, which is 14.7 billion euros for the base case simulation. And the table here shows the acute mortality results, which is over 19,000, and chronic mortality results is over 40,000. Of course, there are some parts that should be studied here, like the effect of air pollution sectors on these results, because in the SNAP categories, we saw that there are many air pollution sectors like the residential heating industry and so on. We are now studying the impact of each sector on these results, because this table shows the overall results of air pollution sources, but the impact of each sector are not same. Industry can be different. Residential heating impact can be different in different cities. So we are working on a journal article currently, which is going to show the impact of each air pollution categories for these results, which will be, I think, more beneficial to the public. And thank you for listening my presentation. And if you have any questions, please do not hesitate to ask.